Welcome to Mile Bluff Unscripted, where we bring you real conversations with the people behind your care. I'm Travis Baumgarten, and today I'm joined by family nurse practitioner JD Lierman to talk about family medicine and primary care. Welcome, JD. To start off, for someone who doesn't currently have a primary healthcare provider, why is it so important to establish that relationship? So, what are they missing out on by not having a regular primary care provider?
Well, I think first off, I mean, even having someone that you name your primary care provider, they know your history, they know your problem list, they know, a lot of medications that you're on. So sometimes even, just shooting them like a quick portal message to see if it's something that, they need to come in with, they're familiar with that provider. I mean, the most significant thing I would say about having a primary care provider is this having that healthcare provider at least be familiar with you. I know sometimes even going to a different provider or even urgent care for things, which is okay too. But that primary care provider may know like your history. Said, hey, I had this last summer. This is what worked well for me, and it'd be a quick and simple visit. So.
Yeah, and that leads nicely into understanding what primary care really includes. So, what kinds of conditions do family medicine providers and family nurse practitioners typically manage?
So typically, with family practice on primary care providers is, first and foremost prevention. Making sure that we're going through screenings for, your colonoscopies, your mammograms, and different things like CT, lung cancer screenings, and some other things that maybe people aren't aware of. And actually making sure immunizations are up to date. Some of the conditions would be, like hypertension, high cholesterol, hyperlipidemia, type 2 diabetes, type 1 diabetes, heart disease, just to name some of the few. But there's a wider range of different things that we see, also musculoskeletal conditions for people, but mostly the hypertension and some of those lifestyle type diseases too. So.
Yeah, and for someone who's never had a regular primary care provider, or maybe hasn't been in for a while, what can they expect during a typical primary care visit with you?
So I'd say typical when if it's someone that hasn't been seen for a while, they're new establishing to myself, it would be obviously going through family history, personal history for themselves, and then I like to go over like their screening options as what pertains to their age. So like colonoscopy, mammogram, things like that. But also if they had any questions or concerns, and then the other thing is just to get a baseline level of labs as well. To look and see how if there's any things like anemia or see how the kidneys are functioning, looking at cholesterol and things like that. And obviously, then, the physical exam is making sure there's not any abnormalities on that as well, too.
Yeah, and once you've gotten to know a patient, what are some of the most common health issues you see in primary care, and how do you typically manage those?
So I think the most common for myself would be hypertension, type 2 diabetes, high cholesterol, high triglycerides, different things like that. And how I go about those is, obviously making sure that we're first changing our lifestyle, doing preventative things, and also if we do need to get on medication, we get on appropriate medication, and then make sure that we monitor those with labs. And then, based on, how the person is doing, if blood pressure's been doing okay, could be every 6 months or so until everything goes away, but or get stable on that medication. And then, obviously for diabetes, making sure that A1C is stable enough for 3 months, and then, obviously checking other things for diabetes as well, and also cholesterol throughout the years and everything too. So.
Yeah, and you mentioned managing health concerns, but primary care is also about preventing problems before they start. Many people only see a provider when they feel sick. So, how do you explain the value of regular checkups and preventative visits, even when someone feels perfectly healthy?
Yeah, so that's like when I have new established care patients, and patients that really don't ever had a primary, haven't seen anyone because, the old age is, I've never had anything wrong with me, so why would I kind of come in that situation? And like I like to educate first and foremost, what screenings are due for different ages, when you need a colonoscopy, if you have a high risk, or family history of it, when you need a mammogram, PAP, different things like that. And then the other thing too is, preventative, we rather try to catch something, in the beginning rather than treat something down the road after someone had an abnormal colonoscopy or CT lung cancer screening. And the big thing is just going over lifestyle modifications as well. Say if they're never had any issues with cholesterol or hypertension, at least, getting a baseline so that we know, say 5 or 10 years from now, like what changed and, what we can do lifestyle wise to change those or prevent those things.
Yeah, and despite all the benefits we've talked about so far, there's still a lot of misconceptions, as usual, with healthcare about primary care and family medicine. What are some of the most common ones that you encounter, and how do you address those with patients?
I think a lot of the misconceptions or the things I run into is people think that they use primary care as just like, oh, I need a referral to like a specialist or something like that. But I think a lot of people misinterpret kind of what primary care does and, the things that we can do besides going to a specialist, which obviously we look at, we assess the patient and obviously assess that risk to see if they would need to be seen by a specialist or not. But I think the biggest thing is just, what a primary care person can or can't do. And, sitting down with an established primary care provider or, having a new primary care provider that can, establish what actually, we're supposed to do in those situations too. So,
Yeah, and one thing that's changed in healthcare over the years is the emphasis on partnering with patients. How do you involve patients and their families in those shared decision making when there are multiple reasonable treatment options, or maybe when the guidelines aren't completely clear for them?
yeah, so I think, I do love to see obviously families and, husbands and wives or even, see the husband, wife and the kids as well. And I at least give them, options that are evidence based and also, what they think about, let's say, for example, their glucose is right on the edge and, could we talk to the family about maybe changing diet, exercise, or even trying medication, and I involve the whole family in that situation, if they're present and everything, and just make everyone aware that, maybe for dinner this is something different, to help dad out or grandpa or something like that too. So or obviously having more emphasis on exercise with younger kids and, getting out and playing and different things like that. So
Yeah, and let's talk about some of the conditions that affect so many people. You kind of touched on it right there, but can you describe how you approach managing common chronic conditions like high blood pressure, diabetes, or high cholesterol, and what good control really means in everyday life for someone?
yeah, so I mean, obviously everyone's different with how they're controlled, and obviously based on age, for glucose and everything like that. But the main thing is just reducing those comorbidities and those risks that can occur from uncontrolled, hypertension, diabetes, and really making sure that we're, managing watching the kidneys, we're watching for any vascular concerns and conditions like that too. And like I said, making sure that over time, let's say you say for 3 months and blood pressure has been stable and, kidney function has been stable, cholesterol has been stable for 6 months and A1C, we kind of use that every 3 months. And if it gets better, we can always adjust it, but obviously making sure that those conditions that that person has doesn't cause anything worse to happen.
Yeah, and medication is always one piece of the puzzle in healthcare, but what role do lifestyle factors like nutrition, exercise, sleep, stress management, what kind of role do that play in everyday life for somebody?
Yeah, and so I think, and I try to explain to my patients a lot of the times that I'm more focused on, those lifestyle modifications to begin with, as those are primary prevention. Obviously, medication does a great job too, but, things just like talking to patients about, making sure that we're getting, at least 150 minutes of, activity per week. And also, I really like to stress the fact of resistance training for people, especially with insulin resistance and just the fact that having that low muscle tone can really set yourself up for a lot of conditions like coronary artery disease, diabetes, and really just making sure that your movement every day is, like I said, movement is medicine. So I try to stress those first, and then obviously medication if necessary too. But
Yeah, and that really highlights the importance of building long-term habits and also, when it comes to having an ongoing relationship with a primary care provider to help improve those health outcomes over time. And how do you see that playing out with your patients?
so I think having a primary care provider, you can see this patient for multiple years, and you can see how they started with having uncontrolled diabetes, or they were struggling with obesity, and you can just see those numbers improve. My favorite thing is seeing someone initially, and they're saying, oh, I have these aches and pains, and I just don't feel right, and they get their diabetes under control, they get their hypertension under control, their weight under control, and they come to me and It's my favorite thing ever is, they feel better and they didn't know that, they could feel such a way. So, I think that really strengthens significance of having a primary care provider as you age and, going forward too. So,
Yeah, and a big part of it, you kind of touched on it earlier, is talking about coordinating care with specialists, hospitals, and other members of the healthcare team to make sure nothing falls through the cracks for your patients. And talk about that relationship when it does come to referrals and working with other members of the healthcare team.
yeah, so I mean, we have a great referral process here at Mile Bluff too, and obviously just talking to the patient and just making sure that a lot of us live in rural areas. So if there's one that would be closer, that's one of the questions I ask patients if they prefer, a larger facility for those referrals. If we don't have them here at Mile Bluff, because we do have the UW Health Specialty Clinic as well, and I also like to explain people, wait times, process of the referral department. And I think on my end too is I just have my assistants follow up and see if they were able to get an appointment or, if one has been scheduled for them as well. So communication is the best for that situation. So
Yeah, and for our listeners, what advice would you give patients about making the most of their primary care visits when they come to see you? So, are there things they should do ahead of time, like preparing questions, tracking symptoms, or bringing a family member along? What kind of advice would you give them?
yeah, so the advice I would give is, I've had patients bring in, like a notebook or something on their phone with notes that they wanted to talk about, which I think is great as well. Because sometimes, as primary care providers, we get busy and, some of those things don't get touched on. And, I really want patients to bring in the most significant symptoms or questions that they have to the appointment so we can address those. And I think really, bringing anybody with you too, because especially husband and wife, or if there's a elderly individual like grandfather, grandma, even bringing someone with you that can help navigate some of those symptoms that they may not be able to describe, I think is a good idea too. So,
Yeah, and shifting gears just a bit, let's talk about you a little bit more. So, what inspired you to become a family nurse practitioner, and what do you find to be the most rewarding part of your everyday work?
yeah, so I think what inspired me is obviously initially I went into the military and worked in the healthcare realm, and I worked with a lot of great nurses, nurse practitioners, physicians, PAs, and I think they just always pushed me to want to be in those roles, and I always looked up to them and always wanted to be one of those providers as well. And especially living around Boston, I mean, I have met a lot of great physicians that still work here, and I always wanted to do what they did and how they had an impact on patients as well. And I think the biggest impact on me is just seeing that person initially say they had the diabetes or the hypertension and just how good they feel after they get it under control and make lifestyle modifications. I think that's the most impressive thing to me and makes me feel like we're doing something and helping people. The big thing is me helping someone in any site certain way. So but yeah, that's the biggest thing. So
Yeah, and finally, as we close out today's episode, we'd love to hear your final thoughts. So, what would you like people to take away from today's conversation?
So I think the biggest thing from today's conversation is obviously, I stress the importance of having a primary care provider. Not only when you have questions, but the significance is someone that knows you, someone that knows your history, your medications. I mean, maybe someone that knows like your family history as well. And as primary care, we're set to prevent things. That's our sole focus. But obviously, acute issues, having that primary care to make an appointment with quick. And then obviously it's, an efficient process if they already know you. But the big thing is just, making sure people are educated on not only preventative screenings, but also lifestyle modifications as they, age and move throughout their years. So
All right. Well, that wraps up this episode of Mile Bluff Unscripted, and we certainly appreciate you spending time with us, and we appreciate JD Lierman for sharing his expertise. So if you'd like to make an appointment with him, please call 608-847-5000. New patients are always welcome. To explore more topics and connect with our providers, visit milebluff.com. Take care, and we'll see you next time.